About 70% of the differentiated thyroid cancers are actually associated with gene mutations and genetic changes associated with kinases. So you can imagine that this entire class of kinase inhibitors has been really what's made the difference. So really what it is that we found some new drugs that were working in other cancers. We took them over to thyroid and said, hey, wait, this is a good match. We should try them. Patients who have thyroid cancer, it's the most common endocrine malignancy. 60,000 patients in the U.S. will be diagnosed, and about 1,800 will actually die of the disease. 80% of those patients have differentiated thyroid cancer, which is the most common type. 90% of the patients actually will do well with surgery and radioactive iodine therapy, which is great news. However, 10% of the patients will not, and they'll actually succumb to their disease. And once the radioactive iodine stops working, what we call RAI refractory or radioactive iodine refractory patients, those patients have an overall survival of only 2.5 to 3.5 years. So Sorafenib was seen to have activity in phase 2 trials prior to this study, and so we designed a pivotal phase 3 double-blind randomized trial to ask the question, what is the efficacy and what is the safety of this drug for this patient population? So 417 patients were enrolled, and they were randomized worldwide. Patients' primary endpoint was progression-free survival, and when we look at the results, it turns out that it was a positive trial, and indeed, Sorafenib extended progression-free survival from 5.8 to 10.8 months.